Hello, friends. Most people think of dementia as permanent, genetic, or inevitable. But in medicine, there's a category that doesn't get talked about nearly enough: reversible dementia. Conditions where memory loss, personality change, confusion, or even psychosis aren't caused by Alzheimer's, but by missing or misbalanced nutrients. Now, what surprises people most is that dementia isn't caused only by deficiencies. In some cases, too much of the wrong nutrient can damage the brain. So in this video, we're going to walk through the top 10 nutrients that can directly cause dementia or dementia-like syndromes when levels are either too low or too high, and why many of these cases were missed for years. So stay with me till the end, because the final nutrient on this list is one of the most commonly over-supplemented, yet it could quietly worsen cognitive decline. Now, if dementia ever seems out of nowhere, this list may explain why. So number 10 is iodine deficiency. Iodine is one of the oldest known causes of cognitive impairment. Severe deficiency causes creatism, but even mild or moderate iodine deficiency in adults can impair memory, processing speed, and executive function. So too little iodine also affects your thyroid hormones. And the lack of thyroid hormones is a well-known cause of depression and dementia. Oftentimes, people with dementia are also depressed. And this is because your thyroid hormones, they regulate your brain metabolism, your neurotransmitter production, the myelin around your nerves, its maintenance, and cerebral blood flow. So when thyroid hormone levels are low, the brain really slows down. And clinically, this may look like memory loss, slowed thinking, depression, apathy, personality changes, and even psychosis. These symptoms that are frequently misdiagnosed as Alzheimer's disease or major depression. In more severe or prolonged cases, untreated hypothyroidism can progress to what is historically called myxedema madness, a state of profound cognitive impairment. And note, you don't have to be severely hypothyroid to have symptoms of memory loss. Subclinical hypothyroidism is also associated with an increased risk of cognitive decline and dementia, especially in older adults. So importantly, many people with cognitive symptoms, they have borderline thyroid labs that are dismissed as normal despite clear symptoms. But when you have hypothyroidism and you can treat it early, that cognitive function will improve significantly. But when it's missed or untreated, often maybe for years, brain changes can become less reversible. And this is a value of going to your doctor to get your annual checkup. Now, what's less discussed is iodine excess. Too much iodine can disrupt thyroid hormone regulation, leading to hypothyroidism or hyperthyroidism, high or low, both of which can cause confusion, brain fog, depression, and dementia-like symptoms. Now, iodine is found primarily in foods that come from the ocean or from animals exposed to iodine through feed or disinfectants. And the richest sources are sea vegetables, especially kelp, like kombu, wakame, nori, or dulse. Some of these sea vegetables have extremely high iodine levels, like kelp. So you can imagine that if you live far from the ocean, like the Great Lakes, the Midwest, the Appalachian regions, you were at high risk of getting iodine deficiency. And that's exactly what happened. In America, before the 1920s, there was an area called the goiter belt. A goiter is when your thyroid gland swells sometimes to the size of a grapefruit, that's caused by chronic iodine deficiency. Now, the problem wasn't genetics, nor was it poverty. It was really geography, because these regions were so far from the ocean, and glacier water and flooding stripped the iodine from the ground. And so local food sources were poor in iodine. It was so bad that communities had high rates of learning difficulties. They had reduced work capacity, and you can imagine that was a huge problem for recruiting U.S. soldiers. And as a result, the public health, working alongside Morton Salt, they created salt with iodine in the early 20th century, and rates dramatically dropped in those regions within a single generation. Now, what's often missed today is that the goiter belt didn't actually disappear. It was just mass. Now, iodinized salt helped to solve the problem only as long as people actually used it. And in modern times, iodine deficiency is quietly reemerging in some groups because not only do people not eat foods from the ocean, but they are also avoiding iodinized salt. They're using non-iodinized specialty salts like sea salt. There is no iodine in sea salt, folks, but there's lots of microplastics. And that's why it tastes so good. You're probably eating some of the plastic. And as a result, the same geography that created the goiter belt still matters, especially for people eating plant-based diets that don't include sea vegetables or skip dairy. Now, dairy has iodine because the disinfectant on the udders is iodine-based. So you're literally eating some disinfectant. Number 9 is selenium. Selenium is critical for antioxidant defense in the brain and for your thyroid hormone conversion. Selenium is an essential component of the family of enzymes called selenoproteins, most notably glutathione peroxidase. These enzymes, they use glutathione as their fuel. And in simple terms, selenium-containing enzymes allow glutathione to do its job efficiently, which is super important because glutathione donates electrons to neutralize harmful substances like peroxides and free radicals. And selenium, it sits at the active site of glutathione to help this reaction to safely go on. So when selenium is adequate, your glutathione can effectively neutralize toxins that would damage your cell membranes, your mitochondria, and your DNA. But when your selenium is low, that glutathione peroxidase activity drops significantly. And this leads to increased oxidative stress. This is why selenium deficiency can mimic glutathione deficiency in clinical effects. Now, this is also why people take selenium for their immunity. Low selenium has been linked to cognitive decline and increased oxidative stress, but excess selenium is a neurotoxin. High intake causes irritability, memory problems, and mood changes, as well as peripheral neuropathy. And in some cases, people who aggressively supplement selenium for immunity, they actually don't realize that they're crossing into toxic territory. Or some people just love Brazil nuts. Brazil nuts have so much selenium in it that eating it every day can potentially be toxic. So if you supplement for protection, your dose matters more than you think. And that's why randomly buying a supplement may not be supportive for your immunity. Now, number 8 is iron. Iron deficiency can impair cognition through reduced oxygen delivery and altered neurotransmitter synthesis. Now, this is especially relevant in women who are menstruating and older adults. But iron overload is even more dangerous for the brain. Excess iron accelerates oxidative damage, accumulates in brain tissue, and is associated with Alzheimer's, Parkinson's, and vascular dementia. Now, organs, including your brain, have no effective way to remove excess iron. That's a big part of the problem. Ever heard of hemochromatosis? It's actually quite a common genetic disorder in which the body absorbs too much iron from food. This leads to progressive iron overload in all kinds of organs. And unlike most other mineral, like I said, the body has no efficient way to get rid of iron once it's stuck in an organ. Accumulation over time, especially in your liver, brain, pancreas, joints, causes damage, oxidative damage, and it's linked to neurodegenerative and dementia risk, particularly when the diagnosis is delayed. And that's because hemochromatosis is treatable and is far less commonly diagnosed than it should be. Now, people of Northern European ancestry are at higher risk. They have the most common form of HFE-related hereditary hemochromatosis, which affects about 1 in 200 to 1 in 300 people in its full genetic form. Roughly 1 in 8 or 1 to 10 can carry at least one copy of the gene mutation, meaning they're carriers, but they may not develop iron overload. Now, diagnosis is typically made with blood tests that shows elevated ferritin and elevated transferrin saturation. And that is followed by genetic testing for confirmation. And it's extremely important for those people to avoid heme iron, which is found in red meat and organ meats and processed meats. Now, did you know that there are natural iron blockers in your food? Polyphenols found in tea, coffee, cocoa, berries, and many herbs significantly reduce iron absorption in food. Calcium also inhibits iron uptake, so including calcium-rich foods with meals can blunt that excessive iron absorption. Phytates, which are found in whole grains, legumes, nuts, and seeds, also further reduce iron absorption. And these are all protective for people prone to iron overload. Hence, another added benefit of eating whole plants with meat. However, there's one ingredient in plants called vitamin C that actually will increase your iron absorption through non-heme iron, meaning sources that are from plants. And the reverse, as you would expect, adding vitamin C to meals is a great way to improve iron absorption for people who are low. However, if you have hemochromatosis, there's an effective early treatment. That's to start regular phlebotomy, blood removal, to lower your iron stores. And with that treatment, many complications can be reversible, preventable if caught early. Advanced organ stages probably aren't reversible. Number 7 is copper. Copper deficiency can cause myelopathy, cognitive dysfunction, and gait disturbances that closely mimic neurodegenerative diseases. However, copper excess is really the problem. That promotes oxidative stress and amyloid aggregation. Elevated copper has been associated with faster cognitive decline, especially when paired with high saturated fat or low zinc levels. Now, most people develop excess copper through a combination of environmental exposure, supplements, non-medical conditions, and dietary imbalance. balance rather than from just eating food by itself. So for example, if you have copper plumbing, you may want to filter that water. If your supplements have copper, just know that that may not be a good idea. Excess copper can deplete your zinc levels. And that's why I don't have a generic supplement, because I know my stuff doesn't have any copper. Copper is pretty good to look at, but you really don't want to use it as cooking. Some of that will get into your food. Now, if you eat shellfish, liver, cocoa, nuts, seeds, and some legumes, they're all good sources of copper. Now, notice that balance matters most, then more is better, right?
Hi, friends. I am so thrilled that you want to take charge of your health and take charge of your food. Now, I know nutrition can be complex, but it doesn't have to be. And I'm here to support you in this lifelong journey. So if you point your camera app to this QR code, it'll take you to a link for a free handout that I created just for you. And if you like it, if you want to see other handouts, please go to the link in my show notes, and then you can leave me your feedback on what I could do to help you in your journey. Okay, back to the video now.
And number 6 is zinc, which is essential for synaptic signaling, memory formation, and immune regulation, and your brain function. Low zinc is associated with depression, poor cognition, and neurodegenerative diseases. But excessive zinc supplementation, that can also suppress copper absorption, and it indirectly can cause neurologic damage as well as dementia-like symptoms. It's another classic example of one nutrient inducing deficiency of another. Now, excess is a classic problem for people who supplement. People don't get excess zinc from eating natural food. Now, don't supplement more than 40 milligrams in a day unless you're supervised by a physician. And that includes total of all your supplements combined. And zinc deficiency, that's more common than most people realize. And it can quietly affect your brain, immune system, your gut, and your hormones long before classic signs appear. Now, zinc is required for over 300 enzymes and plays a direct role in neurotransmitter signaling, synaptic plasticity, memory formation, and mood regulation. Now, when zinc is low, people may experience brain fog, poor concentration, irritability, depression, anxiety, and in more severe cases, cognitive decline that can resemble early dementia. Neurologically, zinc is crucial for regulating glutamate and GABA signaling in the brain. And deficiency, it can lead to excitotoxicity, increased oxidative stress, and impaired neurogenesis, particularly in the hippocampus, the brain's memory center. And this helps explains why low zinc has been linked to Alzheimer's disease progression, depression, and reduced stress tolerance. Zinc is also necessary for proper smell and taste perception. So early deficiency can present with loss of taste or smell and reduce appetite or altered food preferences. Immune dysfunction is another hallmark of zinc. Zinc deficiency impairs both innate and adaptive immunity, increasing susceptibility to infections and prolonging recovery time. Zinc deficient patient may notice frequent colds, slow wound healing, skin rashes, acne-like eruptions, and hair thinning. And in the gut, zinc maintains tight junction integrity. So deficiency can worsen leaky gut, inflammation, and poor nutrient absorption. And this all creates a vicious cycle where deficiency worsens the absorption of other nutrients. And people who are at highest at risk include older people, people with chronic gastrointestinal conditions, those who drink alcohol, and individuals taking antacids. If your diet is low in zinc or high in phytates without adequate preparation, such as not soaking your beans or fermenting your food, excessive zinc loss can also occur with chronic diarrhea, kidney disease, or high sweating. The key takeaway is that zinc deficiency rarely announces itself clearly. It often shows up as an immune weakness, mood changes, cognitive symptoms, or poor recovery, and correcting it can have outsized benefits, but only when balanced carefully with copper and your overall nutrition, rather than just mega dosing blindly one nutrient. Now, number 5 is vitamin D. Low vitamin D is consistently associated with increased dementia risk, brain atrophy, and accelerated cognitive decline. Vitamin D functions as a neurosteroid, not just a bone vitamin. Receptors for vitamin D are widely distributed throughout the brain, especially in areas involved in memory, executive function, and emotional regulation, such as the hippocampus and cortex. Adequate vitamin D supports neuroprotection, neurotransmitter synthesis, calcium regulation in neurons, immune modulation, and clearance of amyloid plaques. It's super important. So when you have low levels, these protective mechanisms weaken. Observational studies repeatedly show that people with low or deficient vitamin D, they just don't do as well. They have a significantly higher risk of developing dementia, and that includes Alzheimer's dementia, as well as other dementias. And if you want a bigger brain, you got to get your levels up because smaller levels mean smaller brains. It also can increase white matter damage, inflammation, impair cerebral blood flow. And importantly, this relationship is dose dependent. The lower the vitamin D, the greater the risk. Now, clinically, vitamin D deficiency can cause brain fog, slow thinking, depression, fatigue, and impaired attention, right? How many people are diagnosed with attention deficit disorder? Or maybe it looks like early dementia or worsening memory. Now, in older adults, low vitamin D also increases fall risk and frailty, and that indirectly accelerates cognitive decline through reduction of mobility and social engagement. And what makes vitamin D particularly relevant is how easy it is to miss. Many people have borderline levels that are technically within lab reference range, but still suboptimal for their brain health. Now, risk is highest in older adults, people with limited sun exposure, darker skinned people, people who are obese or have malabsorption or malnutrition, or kidney disease or liver disease, or those who are eating highly ultra-refined foods. This is one vitamin where people just assume they'll make it if they go out in the sun. The problem is your body may not have the ability to efficiently convert that sunshine in the few minutes you step outside your front door. Active vitamin D is dependent upon several steps, including your liver and your kidneys, and breakdown any one of those steps affects your vitamin D status. Check your levels, go get a supplement. Number 4 is niacin. Niacin deficiency causes pellagra, classically remembered by the 3Ds: dermatitis, diarrhea, and dementia. Now, cognitive symptoms, that includes confusion, aggression, hallucinations, and memory loss. Believe it or not, there was an epidemic of pellagra in the southern US as well as in Europe for decades. And this was one of the clearest examples of how one single nutrient deficiency can puzzle experts. And it took them decades to understand it. Pellagra is caused by niacin, vitamin B3 deficiency, and it became an epidemic in the late 19th and early 20th century, especially in the American South and also in Southern and Eastern Europe. The disease was defined by the classic 3Ds, again, dermatitis, diarrhea, dementia, and it was followed by the 4th D of untreated. The dementia was not subtle. People developed confusion, aggressive hallucinations, paranoia, memory loss, and psychosis. I don't think they were too pleasant to be around. And so many people were institutionalized in asylums with primary psychiatric illnesses. Now, in the US, pellagra exploded after diets shifted heavily towards corn-based foods like grits, cornmeal, and molasses, particularly among poor rural populations. Now, corn itself is not inherently deficient in niacin, but niacin, if untreated in corn, is biologically unavailable unless the corn has been through a process with an alkaline treatment called nixtamalization, a technique used traditionally in indigenous Mesoamerican cultures, but adopted in Europe and in the US. And as a result, millions were consuming corn calories without usable niacin. And so by the early 1900s, pellagra affected millions of Americans, causing tens of thousands of deaths annually. Hospitals and mental institutions, they were filled with pellagra patients. They had pellagra hospitals. And the prevailing belief at the time was that pellagra was caused by infection. Sound familiar? Or spoiled food, or moral weakness. And it wasn't until physician Joseph Goldenberg demonstrated that pellagra could be prevented and cured by diet alone that the nutritional cause was accepted. And his work showed by adding foods rich in niacin, or later pure niacin itself, rapidly reversed symptoms, including dementia. And Europe, they experienced similar outbreaks because they eat food like us, particularly in regions where diets relied heavily on corn, millet, and refined grains without adequate protein. And as in the US, pellagra was most common among the poor, institutionalized, and incarcerated. Basically, groups with limited dietary diversity. The epidemic ended only after food fortification programs were introduced in the 1930s and 1940s, adding niacin to flour and grains. So once niacin intake improved, pellagra, and of course its dementia, nearly disappeared within a generation. Now, the deeper lesson of pellagra epidemic is really the uncurable but important. Entire populations develop dementia not because of genetics and aging, folks, but because of missing nutrients. Just one vitamin like niacin can be the cause. And this remains a powerful reminder that nutrition-related brain disease can look identical to psychiatric or neurodegenerative illnesses. And that without awareness, medicine can mistake deficiency for destiny. Now, number 3 is vitamin E. specifically vitamin E deficiency, which affects neuronal membrane stability and can cause neurological dysfunction, ataxia, and cognitive impairment. And most cases aren't due to poor intake, but fat malabsorption or genetic disorders, which makes the examples especially instructive. One classic example is fat malabsorption syndromes. People with conditions such as cystic fibrosis or chronic pancreatitis or even celiac disease, and as well as Crohn's disease or cholestatic liver disease, they can't absorb fat-soluble vitamins well. So in these cases, when they get vitamin E deficient, they start complaining of peripheral neuropathy, loss of vibration and position sense, muscle weakness, ataxia, they're poorly coordinated, and vision problems. And these neurological symptoms, they can progress and resemble neurodegenerative diseases if untreated. And another well-known example is A-beta lipoproteinemia. That's a rare inherited disorder in which the body cannot make lipoproteins that are needed to transport fat as well as vitamin E. So children with this condition, they develop severe vitamin E deficiency. This leads to severe progressive neurological deterioration, including retinal degeneration, loss of reflexes, and difficulty walking. And without supplementation, the condition can cause permanent disability. And vitamin E deficiency has been observed in people with bariatric surgery, particularly procedures that bypass fat absorption. And these individuals may develop progressive numbness, gait instability, and cognitive slowing years after their surgery if they don't supplement properly. Vitamin E is pretty much exclusively found in fat-containing foods, especially plant foods, and the richest natural sources are seeds and nuts. Sunflower seeds are at some of the top of the list, followed by almonds, hazelnut, pine nuts, and peanuts. Now, these provide alpha tocopherol, the form most active in human tissue. Now, vegetable oils are another major source, as I've mentioned. And wheat germ oil is also extremely high, while safflower oil and sunflower oil, as well as olive oil and canola oil, they provide moderate amounts. And your vitamin E intake is dependent also on your cooking method. Amongst whole plant foods, avocado is also one of the richest sources in vitamin E, but it's also present in spinach, Swiss chard, beets, green beans, and broccoli. But they do offer smaller amounts compared to nuts and seeds. Now, if you decide to supplement, just know that supplemental form is not the same as eating vitamin E found in whole food. And also high dose vitamin E, that actually has been linked to increased mortality, and it may worsen cognitive outcomes in certain populations, likely due to the pro-oxidant effects at high concentrations. Antioxidants can become pro-oxidants when it's misused. So number 2 is thiamine deficiency. That causes Wernicke-Korsakoff syndrome, a devastating syndrome often misdiagnosed as dementia, because people are confused, they have memory loss, they start confabulating, they have personality changes. Thiamine or B1 deficiency is one of the most dramatic and instructive histories in nutrition because its deficiency caused massive neurological disease long before anybody understood vitamins. Beriberi was described for centuries in Asia, particularly after the widespread adoption of polished white rice in the 19th century. Removing the rice bran stripped away the thiamine, and entire populations developed weakness, heart failure, paralysis, and profound cognitive changes. People didn't realize how harmful that processed food was, white rice. They were eating calories, filling their tummies with delicious white rice, but they were starving their nervous system. Are you still eating white rice? You may want to lay off of it. The breakthrough came in the late 1800s when physicians noticed that switching patients from polished white rice to whole or unpolished rice rapidly reverses symptoms. Brown rice is much better if you want to get your vitamin B1. And this observation laid the groundwork for the discovery of vitamins themselves. Thiamine was eventually isolated in the early 20th century, becoming the very first vitamin ever identified, vitamin B1. And beriberi nearly vanished whenever food processing or fortification restored thiamine. Thiamine's role in the brain is central and unforgiving. It's required for glucose metabolism, for mitochondrial energy production, and neurotransmitter synthesis. Without it, your neurons literally cannot generate enough energy to work. And this explains why thiamine deficiency is so devastating and causes Wernicke-Korsakoff syndrome, beriberi of the heart. It's really just a devastating neurological condition marked by confusion, memory loss, confabulation, gait instability, eye movement abnormalities. And historically, this was seen most often in people who drank alcohol. Not because alcohol lacks thiamine, but because alcohol blocks absorption, storage, and activation of thiamine. So if you drink alcohol, you may want to stop that. What's striking is how quickly thiamine deficiency can appear. Unlike vitamin B12, which can be stored for years, thiamine stores are limited and can be depleted in weeks, especially during illness, high carbohydrate intake without thiamine, infection, or critical care. And this is why thiamine deficiency still appears today. It's very prevalent in the elderly, in people who are hospitalized, in people who are in intensive care, in people who have had bariatric surgery, and people with eating disorders on restrictive diets, on a pretty much refined carbohydrate diet, i.e. the standard American diet. And some people inadvertently eat food with enzymes that will actively break down thiamine. And those are diets high in raw freshwater fish, raw shellfish, that can cause thiamine deficiency. And then you may acquire certain bacteria that can produce thiaminases. Potentially conditions like small intestinal bacterial overgrowth, chronic infections, or prolonged antibiotics can disrupt your microbiome to increase thiamine breakdown. And the solution is so simple. You can just take a thiamine supplement. Early treatment with supplements can reverse symptoms, but delayed treatment leads to permanent damage. Hence, I'm a huge fan of thiamine supplementation. So number one is vitamin B12 deficiency. That is one of the most common, most missed, and most reversible causes of dementia. It can cause memory loss, psychosis, personality changes, gait disturbances, nerve damage, even when your blood counts look normal. And this is so important that I dedicated an entire video about vitamin B12. And it's really important that you understand how you're going to get vitamin B12. Because just because it's in your food doesn't mean you're actually absorbing it. And people over 50 are at high risk of being vitamin B12 deficient. And if you want to learn more about that, watch the next video.